fix it. I'm just going to try to fix that. Just going to wait for people to join. Hopefully it's fixed now. So the other live section, I started it, but I believe something was wrong with it. So that's why I'm coming back again. I'm just going to make sure it's fixed. Just give me some time. So if you're watching, please and please kindly let me know where you're watching from. Let me know in the comment section if you can hear me. If you can hear me loud and clear, kindly let me know on the comment section. If you can hear me loud and clear, kindly let me know on the comment section. I had issues with the first live section, so I'm trying to find out if people can hear me loud and clear. Kindly let me know on the comment section. Say hello. I'm trying to sort it out. Okay. If you can hear me, kindly let me know on the comment section. For those that are just joining the live, my name is Mercy Mary. I am a registered nurse midwife, and on this channel, we talk about health. So if you've been asking us questions and we have not been able to answer, this is an opportunity for you to ask your questions so you get answers to it. All right. So today is more or less like a question and answer section, and I'm going to be telling you what I have been up to today. So yesterday and today has been a busy day. I would say quite a busy day for me because I was trying to do what I like. Yeah, I was trying to do what I like. And what I really like is actually I like teaching, I like talking, I like explaining what I know, I like sharing knowledge. I am a nurse by profession. I currently work in the theater. Yeah. I currently work in a theater as an anesthetic and recovery practitioner. So that's what I do. So I do something different from what I teach online. So I know people will be expecting me to teach what I do in the hospital, but I do something different from what I teach online. So hello, Lydia Odami. How are you doing? Trust you're doing great. It's nice having you on our YouTube channel. Do you have any question for us? And let us know if this is the first time of you coming across our YouTube channel. So we started the YouTube channel. I came live for the first live section, but it wasn't showing. I have no ideas why it wasn't showing. People were dropping the comments, but I could not read it. So I have to end the live section to start all over again. Please and please, just to know if you are dropping a comment, just say hello in the comment section and feel free to tell us where you are watching us from. Feel free to tell us where you are watching us from. So for me today, I started the day with my kids. For those that don't know, I have 2 kids. So I started the day with them, getting them sorted out with their breakfast and every bit of it. They are with their grandma now. So I had to use today to shoot some of my videos. Yeah, I had to use the day to shoot some videos that I will be uploading next week. That's this week we're about entering. I have been able to shoot the videos. I've been able to make the shots, and they are really enlightening. They are really informative. So I encourage you, for those that are just coming across, to subscribe and turn on the notification bell, because some people are subscribed, they've not turned on the notification bell, because once you turn on the notification bell, it sends a message to you that we are online, that we have dropped a particular video. But if you don't turn on the notification bell, if we pop a new video, you are not going to get notified and you are not going to get idea of what we have been talking about. So our videos are going to be dropping over the week, so we encourage you to engage on the video, get informations. If you have any clarifications about this video, drop on the comment section. On our new videos, I'm going to be taking out time to reply all the questions. On our new videos, I'm going to be taking out time to answer all the questions as soon as possible, because I don't want a situation where the comments gets bulky again and I can't answer them. So now as the videos pop, within 24 hours of that video popping, all the questions on that particular video is going to be answered immediately. So for those that are I have a lot of questions. This is an opportunity for you to always drop your question. And this live section is an opportunity for you to drop your question. So we have Jesse Kote. Kote, how are you doing? Happy to see you again. It's nice having you on our YouTube channel. Trust you are doing splendid. Do you have any question for us? Let us know in the comment section. And for those that are just coming across this face for the first time, my name is Mercy Mary. I think it's here. That's my name. My name is Mercy Mary, and I can proudly say I am a registered nurse by profession and also the midwife. And because of what I do online, I decided to pursue a master's in public health, and I have a master's degree in public health. So I'm out in the public. I'm talking. All right, I'm out in the public talking to you all. So this is me saying thank you all for joining the live section. If you have any question, drop on the comment section. So in one of the short videos I made, I was trying to look for people's suggestion. Please, this is very important. I advise you to just let me know. Like, particularly, I think 80 to 90% of my videos are talking about sexual and reproductive health. Yeah, 80 to 90% of my videos are talking about sexual and reproductive health. So some of my colleagues, I don't know, they kind of stumbled on my work, on what I do online. And the words I keep hearing from them is that I don't look like what I teach. That they feel I'm usually this calm type. They feel I don't know much about sex and reproduction, and they are surprised with the kind of topic I teach. And I'm like, how do they expect me to look? How do they expect me to feel when I'm at work or when I'm outside? Not just workplaces. I believe most people I come in contact with, they tell me I don't look like what I teach. And I'm like, how do they expect me to look outside? Should I look like a porn star? Should I look like, I don't know. I don't really know how they expect me to look. Because it's not one, it's not two, it's not three. They keep saying I don't look like what I teach. And that gets me thinking, how do they expect a nurse that talks about reproductive health to look? Is there a particular way that you're supposed to look? Is there a particular way that you are supposed to dress because of the topic you teach? So that is what I don't really understand. Is there a particular way I'm supposed to dress? Is there a particular way I'm supposed to look like? Is there a particular way I'm supposed to talk? I always tell them, this is what I always tell them. I tell them that, yes, this is what I do online, and what I do online stay online. When I'm at church, I behave as I'm at church and I'm at church. I'm at work, I do what I'm doing at work. Because what I'm doing at work does not relate to what I do online. So I don't know how people expect me to look. So this got me thinking, like, I really want to hear your suggestion. Hello, Austin, how are you doing? It's nice having you on our live section. Austin said, don't mind them, job. All right, thank you, Austin. How are you doing? Trust you are doing great. I'm super excited to have you here. And if you are watching this video, please double tap the screen and like this video. Double tap the screen. That's all you need to do. Just tap the screen twice and it automatically likes the video. So back to what I was saying. The fact is, I don't really know how they expect me to look because I talk about sex and reproductive health. Do they expect me to dress shabbily? Do they expect me to dress like a porn star? No, I talk about this because a lot of people are shy to talk about it. Like, I got a comment today. I saw this comment on one of my videos that says that I've been able to help his marital life. Yes, I've been able to help his marital life. I'm going to screenshot the comments and put on my YouTube channel. And that made me feel glad that I have been able to save someone's marriage. I have been able to save someone's marriage. I really felt excited. I felt great because at least people are watching and learning. People are watching and getting pregnant. People are watching and improving their sexual life with their partner. People are watching and getting better. Couples are getting better when it comes to sex. That is the goal. All right? The goal is not to look like wherever I go, what I teach. The goal is to pass a message to help marriages last longer, to reduce the rate of divorce. The goal is to make women know that when it comes to sex, they should enjoy it. Yes, I keep saying it. When it comes to sex, they should enjoy it. It's not a matter of the man should enjoy sex alone. It should be both parties. If one person enjoys it and the other doesn't enjoy the feeling, then that's something else. Sex should be enjoyed by both parties. Like, a lot of reasons are going to make intimacy reduced after marriage or especially after having kids. And the earlier you know about it, that, okay, when I have kids, is going to affect intimacy with my partner. What do I do? What do I do to ensure that having kids does not affect the time I spend with my partner? What should I do to ensure that everybody receives equal share and I'm okay mentally, psychologically, and otherwise? All right, these are the things I do. These are the things I focus on. These are the things we talk about on our YouTube channel. And these days, people have sex without consent. We also talk about consent. We've talked about what safe sex is and what it is all about. All right, people need to speak out about how they feel. I got a woman send me a DM and she said, if I ask my husband for sex, he's going to feel I'm a prostitute. He's going to feel I'm loose. If you are on your ovulation period and you want it, ask for it. Don't care what he feels. Like, just ask for what you want. Because it's going to make you feel good. All right? Ask for, like, let him know how you feel. So you are not promiscuous. You are asking your spouse. But a lot of women, I think it's our culture or something that makes us, like, that make ladies so reserved when it comes to their sexual desire. And they feel, oh, they are doing a man favor by having sex with a man. No, you are doing yourself good. Enjoy the flow. You are doing yourself this favor. You are releasing the feel-good hormones. You are releasing the energy. All right? So this is what the YouTube channel is all about. Though it's not just that, we talk about fertility too. How to help women get pregnant. A lot of people have gotten pregnant with our YouTube videos. You can check the comment sections. A lot of people have gotten pregnant. So this is what I do. So I don't know how people expect me to show up at work carrying the stigma, carrying the placard on my head saying this is what I teach. No, work is work. House is house. YouTube is YouTube. There are boundaries to the things I do. You find out what I do online, that should remain on your online space, not my workplace. All right? So let me know in the comment section. So Austin said, exactly, people are too shy to talk about it. Personally, I think people don't talk about enough male circumcision. Yes, thank you very much, Austin. Female circumcision is bad. I've made a video on female circumcision. Please and please. Female circumcision is very bad. I don't know how to stretch the very, very bad. If you are watching this video and you are planning on doing circumcision, or you know anybody planning on doing female circumcision, please report them. Report them. I've made a video on female circumcision. And the earlier people stay informed about female circumcision, the better. Because when our ancestors or our forefathers do this female circumcision, they have the mindset that they are doing the females good. Because when they circumcise a female, the female is not going to be promiscuous. That's not good. Female circumcision, in one way or the other, kind of reduce some ladies' libido. Kind of make them not to have the urge for sex. Kind of make them experience severe pain during sexual intercourse, which ought not to be so. So if you have anybody that is planning to or intending to involve in female genital mutilation, which is known as female circumcision, report them. And if you have the mindset of doing that for your child in order to prevent them from being promiscuous, stop it. Stop it, because you are doing that child more harm than good. I've been in the hospital. I was working as a nurse back then in Nigeria, where a woman rushed her child in. The child was already having some issues with the kidney. Like, it was as a result of, it all started from FGM. Let us catheterize this child. We are unable to see anything to catheterize because they've cut everything out. They've cut the clitoris, cut everything out in the child. Female, I can't remember the age, but that created something very, very painful in my memory. They've circumcised the child. They've taken the clitoris. They've taken the labia majora and minora. I think the person that did it was not, they tell you they have people that are experienced with it. They said the person that did it was not experienced. Experience or no experience, female circumcision is bad. We could not get where to catheterize this little child because at that moment, this particular child needed that catheterization because this child was battling with urinary retention. A lot of things happened that day. I can't really remember because it's like 4 or 5 years ago, but I felt bad. So we had a conversation with the child's elder sister and was like, oh, I have circumcision. I didn't really feel anything. I'm fine. But your younger sister had the same circumcision and look at the condition now. Please and please don't be a particle of FGM. Thank you, Austin, for bringing that topic up. Don't be a particle of FGM, female genital mutilation. Then also, I saw a particular video that was trending on Facebook. I think it's high time for we to start calling people that are teaching things wrongly. I saw a particular video that was trending on Facebook, and a woman was like, oh, don't take your child to court. They should not cut the clitoris, they should not cut the labia majora, but you can use your hands to manipulate it, to reduce it. No, that is still part of FGM. If they say there's a particular woman you will go to that they will use hands to manipulate the labia majora and minora to make it smaller so it's not out, that is still part of FGM. Yes, they are not cutting it with scissors, they are not cutting it with their sharp objects, but they are using their hands to manipulate it. That is part of FGM. So the earlier we stop that, the better. Thank you very much, Austin, for that. I really appreciate it. Thank you very much for staying tuned. So if you have any question, ask. This is what this channel is all about. I just want people to be outspoken about how they feel, about their sexual health, about their reproductive health, how they feel. And this is also a platform enlightening people that when it comes to fertility, when it comes to getting pregnant, the man is also to be held responsible. It's not just the woman. Because I've seen situations, let me share an experience with you. Because having this YouTube channel and having most of my videos about fertility get millions of views, I've come to realize that ignorance is why people are not getting pregnant. I'm going to be sharing, this is like a message I got from someone, and today they are pregnant. Let me tell you what happened. So there was this particular lady, they've been trying to get pregnant for 3 years. 3 good years. So the husband comes and go because the husband is like, was he a taxi driver or something? I can't remember, but if the lady is here, I believe the lady will know I'm talking about her story because I always tell them I will share when I get the opportunity to. So this particular lady, the husband was not always available. And anytime the husband comes, they try to have as much sex as they can. But for good 3 years, they were trying to get pregnant, but they were not able to get pregnant. So they started going from church to churches, like praying about it. Like, oh, pastor will tell them, bring this one, bring that one. They've gone here, up, down. But yet, the baby was not coming up. So the woman sent a message. Was like, this is what we've been battling with. We were battling for trying to get pregnant for the past 3 years. So the first question I asked her was, okay, is your cycle regular? She said yes. She said her cycle is regular. She sees her period every month. I said, good. That's a good one. Having a regular cycle is perfect. Then the next question I asked her was, did your husband do any semen analysis? Has the husband gone for any semen analysis? She said yes. The husband has gone for semen analysis, but the sperm is okay. So she's wondering why she's not pregnant. Then I asked her this question. Something just struck me to ask her this question. Is your husband always available? Is your husband around you, or is always traveling, or is not always? She said her husband goes in from this time to this time of the month, and the husband, the first 2 weeks of the month, the husband, like the first 2 weeks of every month, the husband is not available. So the husband spent 2 weeks in, 2 weeks out, 2 weeks in, 2 weeks out. So when the husband is in, that's when they have sex. But after we finished tracking everything, checking her cycle, checking her husband availability, we found out that the husband was coming home the time the woman was not ovulating. The husband was always at home when the woman was not ovulating, when there was no egg to fertilize. That was when the husband was always coming home. And if there is no egg, a baby cannot be formed. So after much time, we were able to talk. Sorry. I think I need some water. So after much time, we were able to talk. We had a discussion with the husband, the wife, and myself. We had a discussion. And we came to a conclusion that this time to this time, the husband should try as much as possible to be at home. because that's the time his wife's body releases egg. That's the time the wife is ready to take a baby. So we were able to plan, and the man tried to modify the jobs and see what he can do to get it shuffled, and he was able to stay at home during the time. So it was not like the first 2 weeks the husband will be in, and the last 2 weeks the husband will be out, because that last 2 weeks the woman is not ovulating. So lo and behold, within 2 months she got pregnant. 2 months she got pregnant. Sometimes most infertility issues are not as a result of some medical problem or spiritual problem. Some are as a result of ignorance. Some are as a result of lack of knowledge. All right. So that is why I will always emphasize, ladies, know your cycle. It doesn't take anything from you. I think I need water. Just give me some time. All right, I'm back. Take anything from you to know your cycle. So don't let anybody brainwash you. Sometimes all you need is an available husband. Sometimes all you need is for you to just know your cycle and the day you are ovulating. Because you see the egg, Austin said something. Pastors have turned their brain. Yeah, some pastors do that. They make you believe that it's a spiritual warfare, whereas it's lack of knowledge. Whereas it's lack of information that's actually causing it. So the earlier you know your cycle as a lady, I kind of have emphasized on that. When you know your cycle as a lady, when you know the day you're ovulating, you know the day you're menstruating, it gives you charge over your body. It gives you this authority over your body. Like, you know, okay, if I do this period, I'm going to get pregnant. If I do this period, I'm not going to get pregnant. So you avoid pregnancy. It gives you charge over your body. It gives you power. But if you don't know your cycle, it's kind of anything that comes, you take. Anything that comes, you take. Even as little as knowing your cycle is going to help you understand Postino 2. Because there are some people out there, they take Postino 2. They just, oh, I just had sex, Postino 2. I just have sex, Postino 2. The fact is, if your body has already released the egg before you have Postino 2, it's not going to work. So if you know your cycle, you already know, oh, my body has not released egg yet, so let me take Postino 2, it's going to work. But if you don't know your cycle and your body releases that egg before you take Postino 2, that Postino 2 is not going to work. It's not going to work because the egg is already there. What Postino does is that it prevents the egg from coming. It prevents the eggs from getting fertilized. So generally, education is very key. So there was a particular video I made on my YouTube channel, not quite long. I talk about reasons why good girls are going to get pregnant. The good girls, we claim that they are good girls, they are going to get pregnant. And yeah, the bad girls are not going to get pregnant. Being a good girl should not stop you from being informed. Being informed doesn't encourage promiscuity. Being informed doesn't encourage you sleeping around. Being informed doesn't encourage you having premarital sex. No. Being informed help you prevent things, help you stay on the safer side of things. So if you've not watched our video, I would advise you to watch it. Like, the good girls keep getting pregnant and we wonder why. The good girls keep getting pregnant. They are the ones that keep getting pregnant. Have you ever thought about it? The good girls that we imitate, the good girls that we look up to, they are the ones that keep getting pregnant. Have you ever thought about it? They are getting pregnant because of lack of knowledge. They are getting pregnant because of lack of knowledge, because they are scared to ask questions. But the bad girls, they are not getting pregnant, but they are having good sex. So what I'm trying, the whole summary of this video is get education, stay informed. This is not me encouraging promiscuity. This is not me encouraging premarital sex. This is just me telling you, stay informed. All right? So that's what I have to say. So Austin said, our good girls today are the ones that don't know anything. Thank you very much. Be a good girl, be informed. Be a good girl, no boundaries. Be a good girl, no consent. Be a good girl. No, I am in my ovulation period. I am not going to the guy's house that's crushing on me. Because most times, why the good girls get pregnant is because they, for example, a good girl, for example, I'm a good girl, I've not had sex, but every time of the month, I notice that there's this there's this feeling inside of me to get close to a guy, to allow somebody of opposite sex to hug me, just cuddle me. But I don't even understand what is happening, but I know it keeps happening. So during that period, I went to visit that guy that's crushing on me and I'm crushing, we're both crushing on each other. Something can happen and you can have sex. And because that period is ovulation, is even your first time, you can get pregnant. So, but if you are informed and you know you're on your ovulation, you will stay away from that guy's place. You will stay away from your crush. So, staying informed is very important. Information is key. So that's why I'm talking about this. Don't say I'm encouraging any form of promiscuity or premarital sex or things like that. I'm only advising you to get information. Okay. So we have Joshua. Joshua said that I have a question. I'm 45 and never married and now close, but not dating, but now dating a 43-year-old. Is it ignorant to feel that we may have a shorter sex life compared if God gives us a long life? So you said you are 45 and never married and now close, but now dating a 43-year-old. Is it ignorant to feel we may have a shorter sex life compared? So, Joseph, I don't really understand your question. I don't understand where you are talking from. So if I don't really get it, so I don't explain what I don't understand. So Joseph, I don't understand your question. I don't understand this question. When it comes to sex, but generally, when it comes to sexual performance, sexual life, libidos, all these things kind of decreases with age. They decreases with age. As you age, your sexual performance are likely going to decreases because a lot of things are changing. Your hormones are changing. A lot of things are happening. So as you age, things goes down. Fertility goes down. Yes, people get pregnant at age 40, whatever. But generally, from science, age kind of decreases. It's likely going to decrease your sexual performance, sexual drive, fertility, and bits like that. So that's what I have to share, Joseph. I don't know if it helps. So we have Ramya. Ramya said, hey, sister, love from Indian. Rama, is nice having you around. Hope you're doing great. So I say, if we get married today or ahead, is our sex life going to end at mid-50s or early 60s compared to settling with a younger lady? What I generally advise people to do is to, if their sexual life compared to settling with a younger lady. Okay, somebody has answered. I said no, because I have no question for that. Oh, send some, Ramya. You can send some. I don't know why you've not been able to send some gifts. I think I remember Ramya now. Ramya is the girl that's always sending gifts. Sorry, I need to say. I don't know why you're unable to send me gifts. Ramya always sends me gifts on my YouTube channel. Whenever I'm on live and she's on my channel, on the live section, she's sending me gifts. Thank you very much, Ramya. But I don't know why I'm unable to get your gifts. But I wish I get your gifts. I don't know if it's open or I closed it mistakenly. But maybe I will check some other time and see what's happening. Hopefully you join our live section. Joseph, is your question answered? Joseph. Ramya is one of my active subscribers from Indian. I get a lot of gifts from Ramya. Every time she's on my live, I get gifts. So please, everybody be... Only membership perks is there. Oh. If you can join the membership if you can. But I'll try and see. I don't know why. Maybe some other time I'll work on it and see how it goes. All right? You can join the membership perk if you can. If you can afford it, that's fine. All right? So, Joseph, did you get a question? What I even advise for Joseph, getting a younger lady, it might just make things worse, because if the younger lady is having a high sexual drive and you're having a low sexual drive, that might want to push her outside, though that's not the criteria. That might want to push her outside. So it's better to even date closer to your age so that you know both sexual performance are going to decrease at the same time. So getting someone that is younger they might have this high sexual drive, and as you grow older, your sexual drive decreases. So you people might not be compatible. From my own point of view, that's what I'm thinking. That's what I'm seeing it from. But if you get married to like someone like that same age group, you know, okay, as people are growing together, it goes down together. Then nobody's like looking outside or something. I don't know if that makes sense, Joseph. Does that make any sense, Joseph? So if you are watching so far, if you've been watching so far, all you need to do is just double tap the screen. Tap on the screen twice and it automatically likes the video. Tap on the screen twice and it automatically likes the video. If you want to join our membership pack, feel free to join our membership pack. You can join our membership pack. You're going to have a lot in stock for you. So if you want to give gifts, feel free. All right. If you have any question, drop on the comment section and I am willing to take your questions. All right. It's been an interesting section today. I am glad. I think the person that brought up the topic that made it interesting was Austin. And this is me saying thank you to Austin. We've talked about female circumcision. We've talked about women speaking out when it comes to their sexual desires. We've talked about, we've talked about saying no to FGM, saying no to female circumcision, female genital mutilation. So if you have any question, let me know on the comment section, please. Like I have been talking for the past 4 or 5 hours. Exactly. That was what I said. Austin said out, when you settle with a younger lady half your age, you may likely never be on the same page. Because that lady is young, the blood is still fresh, the sexual drive might be on a high level, but you, as you grow old, you are not going to be active like you were when we were younger. So it's just better for you to settle with somebody that you know, okay, it goes down together. Not, oh, your own is going down, the other person's own is still on that same high side. So Austin has given us some answers. He said, when you settle with a younger lady half your age, you may likely never be on the same page. You are going to be on different page. Though it can favor some, but the likelihood is kind of waving and dicing. It's been a long day. For those that are just joining, I believe you missed a lot on this live. So immediately live finished, what I advise you to do is to watch the live section again. From beginning to the end, you are going to gain a lot of value from it. Joseph said, thank you, Mr. Austin. Thank you, Austin. Austin has been a very good friend right from my university days. Yeah. Austin, how are you doing? I trust you are doing great. How's the kids? How's the family? They are fine, I guess. I really appreciate the fact that you're joining my live section, Austin. I don't take that for granted, okay? I don't take that for granted. I'm saying thank you too. So do we have any more questions? The live was supposed to, they are doing great, okay. The live was supposed to stay for like an hour. So I'm trying to see if I can get it to an hour. So if you have any question, ask on the comment section. And if this is your first time of coming across this channel, what I'm advising you to do is to click on that subscribe button. You see the subscribe button there, click on it, turn on the notification bell, because once you turn on the notification bell, whenever we go live, you are able to get notified and you're able to join us. And also whenever we post any videos at all, you are able to get notified. All right. One thing I advise people to do now, for those that are our active subscribers and those that are just joining, when you come across any of our video, please and please make sure you like the video and drop a comment on it. Make sure you like and drop a comment on it, because the algorithm kind of dipped recently. The algorithm dipped and our videos are not getting to a lot of people's faces. Reasons best to YouTube, and I don't know. But I believe if our video gets the engagement that it deserves, the visibility is going to increase. We are going to get more visibility, because this is something everybody needs to be aware of. But if we don't engage but we keep watching, you are not going to be seeing the videos again. I'm not talking about generally, and I'm talking about you. For those that really enjoy like watching our videos, if you don't like or drop a comment, if you don't engage on the video, you are not going to be seeing our videos again. YouTube is going to take it away from your algorithm. But if you keep liking and dropping comments, it's going to appear more on your YouTube and it's going to increase the visibility of that particular video. So that is why I'm always encouraging our active subscribers and everybody that are just joining to help us like and also subscribe and also drop a comment to increase the engagement of the video. So this is me saying thank you to everybody that has joined the live. Glory James, how are you doing? That name look familiar. Glory James, how are you doing? Trust you are doing great. It's nice having you on our channel. Do you have any question for us? And also, where are you watching us from? Because recently I've been getting, I think our videos are trying to come up again, and people keep asking, I'm not seeing your videos. They keep saying it on the comment section, like, I have not been seeing your videos, but we have been trying as much as possible to upload what we can. But the fact is, if you don't engage on it, you are not going to be seeing the videos, except you search. That's how the algorithm works. That's how YouTube, you have to search to get the videos. So if you don't engage on the videos, you're not going to be seeing the videos. So that's why I'm encouraging you. If you enjoy what you see, if you enjoy what you are learning, if you are getting a lot from this channel, always like, always do the thumbs up, and also always drop the comments, because that's going to enable the videos get more reach and also get to your timeline regularly. So this is me saying thank you. Glory, where are you watching us from? How are you doing? I trust you are doing great. It's nice having you on the live session. You came late, Glory, but it's never too late. All you can do is to watch the video at the end. Is to watch the video at the end of the live section. Glory said she's doing great. Thank you so much. You're welcome, Glory. It's been a wonderful live session. I really enjoyed my live today. Thank you for all those that made it engaging. I really enjoyed today's live. I really do enjoy today's live. Do we have any more questions, please? Do we have any more questions, please? Ooh. If you are watching and you've not double tapped the screen to like the video, kindly do so. If you have not okay, Glory says she came in. Glory, you cannot, I will save the video. After the live section, I'll save it. There's a lot of things you need to learn from the video. So after the live section, I'm going to save it. If you're interested, you can watch it and get the information from the live video. All right, Glory James. But if you have any question, feel free to ask. If you have any question, feel free to ask. Do we have any more questions? Do we have any more questions for today? And for those that are just joining, my name is Mercy Mary. Like I said, I'm a registered nurse midwife. If you've missed the highlights of this live sections, what I advise you to do is to wait. At the end of the live section, I'm going to save the video. Then you're going to have it. Then you can watch it. All right? So if there are no more questions, the live is likely going to end in 2 minutes' time. If we don't have any more questions, the live section is likely going to end soon. Okay. Glory James said, can one expose screen time to a baby of 8 months? Generally, I'll give you a general advice and I'll give you what I do. All right. Generally, it is not advisable to expose your baby of 8 months to screen time. And if you must do, it should be limited. So personally, I can't say I kept my child of 8 months off screen time, because sometimes there are sometimes I have to do some kitchen bits and I need to focus on what I'm doing in the kitchen, and I can't bring the 8 months and my 3-year-old to the kitchen. So I put Mrs. Rachel for my child at that particular time. So that period, the child might be on the screen. So it's not something I give regularly, but when I feel I needed that time to do 1 or 2 bits, I expose. But generally, it is not advisable. It is not advisable. After a year, you can introduce some hour of screen time. I think what is it, what health organization that said, I think 2 hours a day, depend on their age, that determines how many hours of screen time they can get a day. So less than 1 year, it is generally not advisable. But if you must, you have to scrutinize the channel that you expose your child to, and you have to kind of restrict the time, the amount of hours they get. If your child wants Miss Rachel, for me, it's good. I'm not a child psychologist or child, but for me, personally, my son, I expose him to Mrs. Rachel, especially when I have a lot of things to do and I have to finish up as soon as possible. So he does that. But I try as much as possible to engage him more with my free time. Yeah, I try to do that as much as I can. But if it's like above my power or beyond my power, then he has the screen time. So just try to limit it so they don't end up getting addicted to it. Personally, I prefer using the television, instead of a tablet. Yeah, I use the television instead of a tablet for them. So when I off the TV, it's gone. They can't switch it on, but I don't use tablets for them. They have their tablets. I think the tablet is like a birthday gift, but they don't use it. They rarely use the tablet. So for my daughter, I use the tablet when I'm making her hair. So that helps to distract her. You get that tablet helps to distract her from the pain that she might experience. You know, kids and when making their hair. So that's the only time I bring the tablet to my daughter. It helps me braid her hair when her grandma is making her hair. So that's the time I use the tablet for my daughter. Other than that, most of their screen time are on TV. So I don't know if that helps, Glory James. But I try to restrict it and do some more engaging things. If I take the screen time from them, they don't scream because they are not like addicted to it. They're not used to it. It's just like what they do. They can stay 1-2 days if I'm at home without screen time. 1-2 days, they can stay without screen time if I'm at home. So, but now I go to work, so a lot of things has to change and there has to be a modification with what they do. But I try to reduce screen time because when you reduce screen time, it goes a long way to help. It helps a lot. You hardly see unnecessary tantrums. They go to bed on time. You understand? Like too much screen time can affect their sleep pattern. So if you reduce screen time, it just helps you automatically create a sleep routine. They go to bed on time. They wake up early. So those unnecessary tantrums, you don't tend to. Kids can throw that tantrums, but it's not going to be there when you give them excessive screen time and things like that. So that's that. So do we have any more questions? I'm not a child therapist, though. I'm not a child psychologist. I'm just giving based on my experience, okay? I just do what works for me. So that's it. I do what works for me and what is helping me. So do we have any more questions? We've spent 43 minutes on these live sections. Do we have any more questions? Do we have any more questions? Like I just said, I enjoyed today's live. It was interactive. It was engaging. If you've missed this live section, what you need to do so that you don't miss too much is to end the live section and play the beginning. You're going to enjoy it, trust me. You're going to enjoy the beginning of the live section. It was really engaging and informative. So that's one thing I encourage you to do, all right? Let me just wait for another 1 minute. If there is no question, I will end the live. I'm waiting for another few minutes. If there is no question, I'm going to end the live. And if you've been watching so far, double tap the screen. Just tap on the screen twice and it automatically likes the video. That's all you need to do. No stress. Just tap the screen. Touch the screen twice. Touch the screen twice and it automatically likes the video. So very just for now, no questions. I will rewatch the live section. Nice. If you rewatch the live section, drop a comment. Let us know what you think about the live section. And if you want us to continuously discuss these same topics again on the live section, let us know. Okay? Any more questions from our end? For those that are just joining, like I last said, we watch the live section. You are going to learn a lot from it. And if this is the first time of coming across this channel, my name is Mercy Mary. I am a registered nurse midwife, but I'm not practicing as a midwife. Adam Cook said, not seen you in a long time. Thank you for keeping the light shining bright for people. Bless. Thank you, Adam Cook. Adam Cook, I think the reason why you're not seeing me is because you're not engaging on our videos, Adam. Like I was explaining this like to people that are just joining, that if you don't like and you don't comment or engage on our videos, you're not going to be seeing more of our videos. So the more you like, the more you comment, the more you engage on our videos, the more you see them. Please and please, Adam, we've tried to show up. Please, whenever you see our videos, comment. Whenever you see our videos, like. The more you like them, the more you comment, the more we show on your faces. But if you don't like, you don't comment, the algorithm is not going to bring our videos to your faces. The algorithm is not going to make us see you and you see us. All right, Adam Cook, how are you doing? Trust you're doing great. It's nice having you. Do you have any question for us? We're trying to bring the light, like you said. So Fatima said, say Sophia, please. I liked and sub, please. All right, Fatima. Just like, subscribe. All right, that's it. That's all you need to do. So we have Christy Counseling Groom said hi. Christy, how are you doing? Trust you're doing great. Hope you're nice. It's nice having you. So if you want to be seeing more of our videos, you want to see more of our live section, subscribe. You see that bell close by, turn on the notification bell. You're going to be getting more videos from us and opportunities to ask your questions. So Adam Cook said, I don't have an STI. I never had one. I only know about addiction. Okay. Are you addicted to something? Are you addicted to drugs? Are you addicted to smoking? Depends on what addiction you're talking about. Depending on what addiction you're talking about, Adam Cook. Oh, Fatima said, oh, thanks so much. You know, this is my first time. I like and subscribe. Oh my God, I like your makeup. Thank you very much, Fatima. If this is your first time, Fatima, thank you for liking. Thank you for subscribing. And thank you for liking my makeup. I really do appreciate you, Fatima. And make sure you engage on our videos, like I earlier said. If you continuously engage on our videos, we are going to show up on your timeline. We're going to show up on your faces. But if you don't engage on our videos, if you don't follow, if you don't like, if you don't drop a comment, we are not going to appear. So Fatima, my name is Mercy. If you are just coming across me for the first time, my name is Mercy and I am a nurse midwife, but I currently practice as a nurse. All right, Fatima is asking if I have a sibling. Yes, I have 6 siblings. Is it 6? I have 5 siblings, sorry. Plus me 6. I have 5 siblings. Yes, I do have siblings. I have a lot of them. Fatima, how are you doing? Where are you watching us from, Fatima? Do we have any more questions? Adam Cook, I'm still waiting for the addiction you're talking about. You don't need to know my age, Adam. Why are you asking all the questions? Fatima, I mean. Fatima, why do you need to know my age? And why do you need to know if I have siblings? Do you have any other questions outside personal information about me? I think if you follow my YouTube channel to my next birthday, I'm going to be revealing my age on my next birthday. So follow my YouTube channel. You're going to get my age on my next birthday. So I'm going to be revealing my age to my YouTube fans on my next birthday. So if you are following me, you will know my age by then. Is that okay, Fatima? I think on my next birthday, everybody's going to know my age. So do we have more questions? Or should we end the live? Let me know in the comment section. Should we end it? We've spent 50 minutes already. Should we end it? Do we have any more questions? The fact is, when I want to end the live, another question comes in. So that's the problem now. Yes, I always make videos. You can check our YouTube channel, Fatima. I always make videos. You can check our last video. You can check when you subscribe and turn on the notification bell, you will always get our videos. You will always get notified whenever we upload videos. So all you need to do is to just check, turn on the notification bell. I always do make videos, all right? Oh, Adam said substances. It's talking about addiction to substances, but I know a lot about recovery. That's good. That's a first step. And I want to say I'm proud of you. Yes. One thing is getting addicted. And the second thing is working on the steps, reading about the steps or taking steps into recovery. So that's a lot. I just want to say congratulations. You're doing really well for yourself. So some people get addicted and they don't think about recovery. For you to think about recovery and you know the 12 steps recovery is the best. So I encourage you to keep on, and I encourage you to keep pushing till it's finally over. Okay. I know it's going to be a lot of pain. It's going to give you a lot of discomfort. But from me to you, I'm just telling you not to give up. Even if you fall, rise again. Just know you are not perfect. You are trying, you are going on the path that might be challenging, that might take a lot of time, but definitely you overcome. All right, Adams, I wish you all the very best in your recovery journey. So Fatima said, I always see your video. They are so nice. Thank you very much. Fatima, you're always seeing my videos, but I'm not seeing your comments. If I don't see your comments, then you are not seeing my videos, Fatima. If you are seeing my videos, for me to know you are seeing my videos, you have to comment and you have to like. So that makes it easy. Is that okay, Fatima? So when else you see my videos, Fatima, what I advise you to do is to like, comment, and share how you feel. If you have any question, let me know. All right, Fatima said, please do not end the live, please. If there are no questions, Fatima, I will have to end the live because the section is more or less like a question and answer section to take all your. So Scabrak said this. What do you mean by this? Adam Cook said, addiction is a spiritual disease that manifests as substance use. Thank you. You have a great energy. Thank you very much, Adam Cook. I seriously wish you all the very best. I want to hear testimony that you are fully recovered. That is my prayer for you. I want to hear testimonies that you are fully recovered. Okay? Fatima said, do you have any brothers? Yes, I have one brother. I have one brother. SK Barak 2009 said, I will support you. Thank you very much to all my supporters. All you have to do to support Nurses Lecture Room, subscribe to the YouTube channel. There's a notification bell. Turn on the notification bell. That's another thing. Then if you want to be part of our membership, like a closed niche of Nurses Lecture Room, there's a membership that you need to pay for. You can pay for that. I'm not pressurizing anybody to do that, okay? So the major support I need is for you to subscribe. And the second support I need to do is for you to turn on the notification bell. And whenever you see our videos, you've enjoyed the videos, I advise you to comment and like. Because the more you do that, the more you help us reach a lot of people, and the more you allow our videos show on your faces. Okay? Yes, he is the big sibling. Yeah, he's the first child. He's married. Yeah, he's a big sibling. Okay, now the video was supposed to end at 50. We are getting to 1 hour now. All right. Do we have any question? Any more questions? Okay, we have a make art and crafts with Isha. Make art and crafts with Isha. Please say my name, Isha. Isha, how are you doing? Trust you're doing great. It's nice having you on the live section. Do you make art and crafts, and what do you actually do? So Fatima said, oh, I'm sorry, I have to go. All right, Fatima, see you on our next live section. It's nice having you, and thank you for keeping our YouTube channel engaged. So Adam Cook said, going to get NHS detox in the next couple of months. The pain relief is not working, but I only get the head fog. I think you should speak to your GP about it. If it's really creating a lot of discomfort, please and please, you have to speak to your GP about it. Explain how you feel so that they can know the best way to provide help to you. Okay, if you explain how you feel, they are able to provide the best help for you. I don't know if that helps. If you're having any discomfort, always speak to your GP. It's not going to be an easy journey, but I believe with determination, you are able to get to where you need to get to. All right, with determination, you are able to get to where you need to get to. So we have Olamilekan Biola. Hello, how are you doing? Trust you are doing great, Olamilekan, and hope you are doing fine. It's nice having you. Do you have any question for us? So Fatima said, I don't want to go, but I must go. Yeah, you need to. I understand, Fatima. Thank you very much for joining. The live section is going to be ending in the next 5 minutes. We've tried for today, and we're going to be ending it in the next 5 minutes. Thank you all for joining. So Olamilekan, how are you doing? It's nice having you. So we have 4 more minutes to go. If there are any questions, feel free to drop on the comment section. For those that are just joining, that didn't join at the very beginning of the live section, I would encourage you all at the end of the live section. I'm going to be saving the video. So all you need to do is to go back and watch the full live video. That's going to go a long way to actually help you. All right, because at the beginning of the video, we were able to talk about female genital mutilation. We talked about how female genital mutilation is taking place. We talked about female circumcision, and we are saying an end to female circumcision. Female circumcision. There is no need for a female child to be circumcised on no circumstances. Some circumcision, they say it's advisable. Others, no circumcision is advisable. Whether you are using sharp objects to cut the clitoris, the labia majora and minora, or you are using hand to manipulate the labia majora and minora, none of this is advisable. So we said that at the beginning of this video when Austin brought up the question. So we're able to talk about that. And at the beginning of this video, we talk about women speaking out about their sexual drive. It is not something they need to keep to themselves. It is not something they need to hide, but rather speak about. The more we speak about it, the more the better. And also speaking about how you feel doesn't make you promiscuous. Speaking about how you feel doesn't make you a spoilt wife. Speaking about how you feel doesn't make you less of yourself as a woman. So the earlier you speak about how you feel when it comes to your sexual desire, the better for you as a woman. So that is what we talked about in the early beginning of this video. And I will encourage you all to stay back and rewatch that particular video. And I hope that helped you all. So we have 3 minutes to the end of the live section. And if there are any questions, drop on the comment section. Don't forget to rewatch the video. And for those that are just joining us, my name is Mercy Mary. I am a registered nurse midwife, but I'm not practicing as a midwife, but rather I'm practicing as a theater practitioner. And I have a master's degree in public health. And what I do here is to encourage women speaking out and also men speaking out when it comes to their sexual and reproductive health. If you've not watched our previous video, kindly do so. And for those that want our videos to be on their faces, all we are asking you to do is to drop a comment and also like so that our videos appear more on your timeline. So that is all we are asking from you to do. And for all those that have been supporting us so far with your gifts, with your membership perks, this is Nurse Mercy Mary saying thank you. Expect to see more of our faces. Fatima, thank you very much. Fatima, is nice having you. Bye, Fatima. I would like to know where you are watching us from, Fatima. I would like to know where you're watching us from. We only have 2 minutes and the live section is going to be ending soon. Because I've been doing a lot. I've been shooting some of the videos and it's been a lot for today. So we have 2 minutes and the video is going to be ending now in 2 minutes time. So we have okay, now it's 1 minute. In 1 minute, the video is going to be ending. So if you have any question in 1 minute time, I should be able to take the last questions. All right. So thank you all for joining. This is me saying thank you all. Thank you all for keeping us engaged. Thank you all for keeping us tuned. Like I earlier said, we've made our videos. Our videos are going to be dropping over the week. We have shorts explaining the signs of pregnancy. We have shorts explaining the signs of ovulation that you need to look out for. So that's it. So Fatima is asking, are you a Muslim? No, Fatima, I am not a Muslim. I am not a Muslim. All right. So this is the last thank you. This is me saying thank you to Austin. This is me saying thank you to Fatima. Okay, Adam Cook. Your question is, Adam Cook is asking, if I had listened to a consultant surgeon, I would be missing a leg. They are overpaid. Think they have all the answers. Not good. I thank you. God bless. You're welcome. So I don't understand what you said, but if you had listened to a consultant surgeon, you'd have been missing a leg. But in all, one thing I advise people to do is always speak to your healthcare practitioner, express your concerns to them about your health. They have no right to judge you, but they have the right to provide a better solution for you on what they feel is going to be best for you. So when he talked about being overpaid, surgeons, consultants, trust me, they are doing a lot of work more than you can imagine. Yeah, there is a lot of work in the NHS, and I believe the surgeons and consultants are giving their very best. So all we need to do is encourage them to actually give their very best. It's a lot of work. Like they have a lot of population, a lot of patients they are attending to. So it's a lot of work. They are doing their very best. That's one thing I'm sure of. I've come across with consultants. I work in a theater. I come across with consultants, registrars, HHO, C21. Trust me, those doctors are doing their very best. They are giving the best advice. They're trying as much as possible to ensure that patients are well taken care of. Patients are giving the best they can think of. So that is what I think about the consultant. They are really doing their best, but sometimes we don't really see that they are giving their best. Sometimes there is a work overload, but they are trying their very best to ensure that the safety of the patient is not compromised. So that's what I have to say, Adam Cook, about surgeons. Sometimes I feel they are not well paid. They need to be paying more. All right. So James said, my neck have black color. What is the cause? I don't really know that because I don't have ideas when it comes to skin. I'm sorry. I can't give advice when it comes to skin. I'm not a trained dermatologist. I don't have ideas when it comes to skin. So I can't really help with that. And if you have major concerns like the skin is giving you problems, so what I advise for you to do is to actually speak with a doctor or speak with your healthcare practitioner. So Adam Cook said, I have lymphoedema. I don't understand how much work and stress they do. They have been miseducated. Unfortunately, greatest medical advances made after a war. Okay, that I don't understand. That I don't understand what you're trying to push forward. But in all, one thing I'm sure of is that they want the best. I don't know which consultant you've come across, but I've come across a lot of consultants, surgeons, registrars. But one thing I can say is that they are doing their very best to ensure that patient safety is not compromised and everything goes well. So it's more than 1 hour. Like I said, life is going to last for 1 hour because I need to get some rest and I need to do some house bits. So this is me saying thank you all for joining our live section. This is me saying thank you all for following, liking, subscribing. Make sure you engage on our videos. Any of our videos you see, drop how you feel about the video. Drop it in the comment section. Like the video. All right. Thank you very much. Adam Cook said, you're too young to know. Bless your kind heart. You're welcome. I don't know what you're trying to say, but in all, I wish you all the best and I pray you recover swiftly. Bye, everyone. Bye. Thank you. Thank you for joining our live. Don't forget to watch the live. Don't forget to rewatch the live. Start from the beginning. Watch if you missed a lot. You're going to enjoy it. Trust me. So we have Happy. Love you too, baby. Love you. Love you, Happy. Bye. See you on our next live section.